I'm Damon Anderson, physical therapist, president of Damon Anderson Physical Therapy, Physical Monterey. And today we're here to talk with Joel Franklin, one of my friends, an attorney and a patient who's got Achilles tendinopathy, chronic Achilles tendon problems. He happens to be a national level high performance racquetball player, which puts a lot of pressure on your Achilles tendon. And through treatment, through the Softwave tissue regeneration therapy modality, he has experienced amazing improvement in his tendinopathy, which has been there for years.
At least 2 years now. I think it's been about 2 years that we've been working on this.
Okay.
So I, first want to say that I've been working with Damon for several years on this issue, and it was a chronic problem I had and an injury I had from playing very competitive racquetball. And we've tried some other physical therapy modalities which gave me some relief, gave me some partial relief, and allowed me to continue to compete. I train sometimes 4 or 5 times a week and play tournaments several times during the year. But this technology, the Softwave technology that Damon introduced several months ago, has really brought significant relief to my Achilles tendon, and can actually sort of see the kind of swelling and kind of scar tissue that was there is shrinking, and it's getting smoother, and I'm able to just move with a lot less pain and ease and more confidence in my ability to kind of move laterally and to have quick stop and go movements which racquetball requires. And it's really been, in my view, the most effective treatment I've had for my Achilles tendon problem, which Damon has been taking care of now for some time. And as an athlete, he appreciates the kind of demands that I have. In my 60s now, I'm still competing seriously, and Damon understands my desire to continue to do that. And this particular treatment has been very effective in allowing me to continue to play at the level I want to play at.
Excellent, thank you. We will now demonstrate a treatment using the Softwave on Joel's Achilles tendon. So we're going to have you go ahead and lie down, Joel, on your stomach.
Okay, I'll roll up my pants here.
We're going to adjust the intensity on the machine. We're going to put some pillows underneath here, and we're going to show this normal Achilles tendon here. This is a normal thickness, tissue quality. This is his injured side. And I would say it was at least 50% thicker when we started. You can still see some thickening. This is pretty normal here in comparison. You can see some thickening right here. It's still there. And Joel, probably that's more tender here.
Yes, it's still tender.
Still
where
tender.
You're pressing, but not as intensely painful as it would be when you normally would touch it.
Yeah.
So it's
So-
definitely healing from my perspective.
Yeah. So we're going to treat this area. You'll see when we treat the injured area, it will be uncomfortable, and Joel can give us some verbal feedback. And we'll also, just for demonstration purposes, take the modality up here, the tissue regeneration technologies, Softwave, Shockwave, up to his calf where he doesn't have any pathology and he won't feel any pain or discomfort up there. It's not intense discomfort, but I would at least call it moderate, maybe even moderate plus at times. Joel, do you want to give me feedback there?
I think there are spots where the tissue regeneration wave, you can feel it. It's intense, but it's not. It's certainly something I can work with, and it's not unbearable pain. When there is some discomfort, I have a pretty high pain threshold. But I can tell that it's working even when you're using it on me. It feels much better really after the treatment immediately as well.
So this particular technology uses some liquid to generate or to transmit the shockwave. It's an unfocused shockwave, which has particular properties to produce the healing effect, the tissue regeneration effect. This process gets the air bubbles out of the device. You do a couple of shots like that. You check and see, you know, air bubbles are in there. Couple more. And we're good. We put a gel, just like ultrasound gel, on the treatment area. Raise the table up a little bit. So this is a typical intensity we're starting at. We're going to do a little bit up on the calf where he doesn't have any pathology and demonstrate that that's not painful.
Yeah, don't feel anything there at all.
Don't feel anything at all. Tell me when you start to feel something. So we scan the area.
Yeah, right in there, Damon, I'm feeling some, you know, obviously some
Discomfort.
discomfort, yes.
Okay. So then we ask Joel if the discomfort decreases as we hold it on that spot. What we're looking for is some decrease in discomfort.
A little bit, right in there, yeah, that's the
There.
spot.
Okay.
I can feel that.
Okay. So we
And,
use that. Go ahead. Sorry.
No, I mean, you're hitting a spot that I clearly has got discomfort in it.
Okay. Tell me when it goes down some.
A little bit better there.
Okay. So now we're getting to that point where you can see the thickening in this tendon. Is
Yeah,
that
right
so?
there.
Right there. Okay.
Yeah, you hit the spot.
Okay. Tell me when it goes down some.
That's decreased a little bit.
Okay. Well, now we're going to go over the center of that spot that's thick.
Yeah, that hurts.
Okay. Tell me when it changes.
It's gotten a little bit better there.
Okay. And now we're going on this side. You feel that?
I do.
Okay.
Yeah, that's the spot right there.
Okay.
Yeah, that's a little bit better.
Okay. How about over here?
Yeah.
Okay. We're kind of on the upper edge of that.
Upper edge, yeah, that's kind of,
Okay. Change yet?
that's
A little bit?
changed a little bit, yeah.
Okay. You go right over the top of it. You feel that?
I do, it's not as bad as the other spots that you've hit.
Okay. And then swing back over to the inside. Anything there?
A little bit.
Okay. Okay. Back down right on it.
Yeah, I think that's
Right there?
the lower spot, yeah, right there.
Okay. We're going to go down a little bit.
Yeah, that's painful around, yeah,
Okay. So
that
this
hurts
is in the
there.
insertion, even though it's not as thick.
Yeah,
He's
that hurts.
definitely sorry.
That's okay. I mean, I know
Hang in there.
I am.
Tell me when it's down a bit.
It's down a little bit.
Okay. Go in the center. There, anything? Not so
Not
much?
too bad on that side, yeah,
How about on this side?
yeah, right in there.
Okay, we'll hold it there. Tell me when it goes down.
That's a little bit better.
Okay. And we're going to pause. If we look over here on the machine, we're at 786 shocks. We've delivered 1,651 millijoules of energy. And our treatment goal or dose is going to be 1,500 shock waves. We're going to go up in intensity for a shorter amount of time. And this will be uncomfortable. If it's too much, Joel, let me know.
Okay.
We won't do as many at this level. If it's too much, we'll go down. Okay, so we're going 0.13 from so a 30% increase from 0.10. That's millijoules per millimeter squared, if anybody cares. Are you ready?
Yep.
Okay. So we're gonna go right down to this is gonna be uncomfortable. Hang in there. We don't have to wait too long for this. You all right?
Yeah.
Okay, we'll do a few on the inside.
Yeah.
Hang in there. And then Joel will notice that every once in a while there is a stronger one.
Yeah, getting a couple of really tender spots.
Yeah, this is the main. Hang in there and then we'll give you a break and we'll go back to the less intense.
Yeah, it kind of just causes a reflex, you know, like a,
Yeah, you squirm.
like a pain reflex.
Yeah. So you're being very, very good and very tough. That's about as much as discomfort as you want to deal with. And then we're going to go back down to 0.10 and finish out the last 500. And we're at 964, so we're going to do 536 more. I don't have to count. The machine counts, fortunately. So usually after the strong one, this doesn't feel quite as,
Not as intense, yeah, I mean, you can still feel it,
yeah.
but it's not,
I'm gonna spend most of my time where we know most of the pathology seems to be, right on that lump, and then down on the insertion area.
yeah. Yeah, the upper area seems to have healed up pretty, it used to be a little higher, David, as you recall. And I
Yeah,
think
yeah,
it's
yeah.
Pretty much healed up.
Yeah, a little bit just above, I would say, from your scan. But this seemed like the main spot, and then this inside of the attachment.
Yeah, that's still tender right in there.
Okay, we'll spend a little time there. Tell me if that goes down a little bit. You saw him move when they're more intense. So this is an asymmetrical shockwave. Sorry, go ahead, Joel.
Yeah, it's going down a little bit,
Okay.
but it's still, I can still feel it.
Yeah.
Yeah, that's better in there. That's a tender spot.
Right there?
Yep.
Okay.
Yeah, all in there.
I'm gonna go right over the top of it here.
Okay.
Almost there.
Okay.
Got a strong one there.
Yeah, we'll find in that one spot.
All right, very good.
All right, I survived.
You survived. So that completes our treatment today of the Achilles for Joel. And thank you for your interest in our Softwave tissue regeneration therapies, shockwave therapy. It's innovative, it's amazingly effective for especially tendon and connective tissue problems, muscle problems, rotator cuff problems. It's especially useful. Give us a call and we can talk about if this might be something that you're interested in. Thank you.